Okay, just touching on one of the other posts, the back end, you mentioned that we have something like a 95% success rate, which is pretty phenomenal. I have my own opinions on why that possibly is, but I'd be interested to know what you think it is that makes a difference to people coming in to clinic to see you.
Well, another big question. I've been doing this for 28 years, and I've worked in lots of elite sports settings.
But you're only 35.
31. And I think the cumulative experience that I've gained, I think I started off as one of those bombastic people that thought they could fix the world and thought it was all down to me. And I think as you grow older and you learn more about human physiology, psychology, patients' expectations, I think it starts to shift the balance of power firmly back into the patient's corner. And I think the difference in terms of my practice, I think I've realised that giving people diagnoses isn't very helpful. And I think lots of people hang, like I was talking about with the glutes activation stuff, you say, right, you've got a degenerative disc disease. Now immediately, people have read some stuff on Google or have seen some stuff on the telly, and they immediately start to catastrophise.
So a nocebo effect.
Yeah, so that sets up a whole cascade of hormones that are produced. There's probably some rewiring that takes place in your brain.
I think serotonin and dopamine, predominant brains are more prone to being told something catastrophic.
Yeah, so I've been aware of that for a long time. Did you say that like look of, what the hell is she talking about? So I've been aware of...
I read a paper yesterday.
Yeah, I've been aware of that kind of rhetoric for quite a while. And certainly over the last year, I've made big inroads into not diagnosing injuries, unless they're things like muscle strains, because it is what it is with a muscle strain. But with these complex biomechanical problems, for which there isn't a diagnosis that fits for many of them, because it's something's going on upstream, something's going on downstream, and maybe the knee or the elbow is the final point of compensation. I think it's easier to work and address problems, and I think problems, when they're explained to the client, are far less scary than diagnoses. So I think that's the first change. I think as a good therapist, I think your hands become, like I joke with Dan about, my hands feel like they're about this big.
Kenny Everett hands.
They're not, obviously, but...
Probably all a bit too young to even know who Kenny Everett is.
Yeah, but in terms of your homunculus, so the diagrammatic representation of your body map on the frontal cortex of your brain, they probably occupy a larger surface area, which is again what tends to happen when you sort of start to catastrophise about your injuries. So now I've got these massive hands as far as my brain's concerned, and they're very good at picking up tissue texture changes, and I think using that feedback in order to make your client aware that you can feel that as well, I think helps them to trust you a little bit better. I think it develops a bit of rapport, which I think is really important. And I think as a therapist, like I said to you before, I think that it's not about me fixing you, it's about me putting you into a position where your body can then fix itself. But I think in order to do that, you have to have some belief and some faith in the person that's working on you. So 28 years of clinical experience, these hands are very sensitive, and I can feel those tissue texture changes in people's bodies as easily as they can. I don't feel the pain, but I can feel what's going on under those tissues. So I think we don't diagnose, we draw up problem lists, and everything we do is about empowering the patient, not making them reliant upon treatment. Because again, another thing I think that we see a lot of is those people that come back and say, oh, I've been seeing a therapist for a year and it's a little bit better, but it's not quite better. And then I see them and usually a couple of treatments and it's gone. I don't think that's because I'm brilliant. I think I'm a relatively average therapist. Dan will probably shout at me for saying that. in a world of mediocrity. But I am very, very aware of how important it is for the patient to become part of that treatment process. And if you have treatment with me, you'll realise very early on that you're as involved in that process as I am when I'm putting my elbow into your back. Does that answer the question?
Yeah, excellent. Thank you.